If you've been on the internet at all, I don't know why I said if as if yif, but here we are. Apparently, that's how today's going to go. Friends, if you've been on the internet at all recently and you even know of nurses, you have probably heard of the fact that there's a nursing union strike going on right now in Minneapolis, Minnesota. And according to the poll, 82% of you have heard of this. If you have not, let me catch you up to speed in just a moment, super duper fast. Well, we can do it now. Essentially, there is a union strike going on in Minnesota, in the Twin Cities and the Twin Ports, leaving about 15,000, I believe. My brain is taking a brain fart. Like 15,000 nurses walking out of the hospital, not working in those hospitals, and saying basically, hey, you won't give us what we want, so we're not going to come to work anymore. And the strike started yesterday. And it is, to say it is causing some grief on the internet is probably putting it mildly. You've probably seen things that say things like nurses want a 30% pay increase, like those dirty scoundrels. And this isn't really about patients. This is about nurses just wanting more money. It's nurses profit over patients. You know, nurses are just as bad as the hospital administrators and CEOs. And it's a hot mess. I've been in the comment section battling all day, you know, because should I probably battle with people in comment sections? No, but they come out and they're saying so many things, and the hospitals are saying so many things that paint nursing in such a bad light. And today we're going to set a few of the records straight. We're just going to clear some things up. I was told in my last video that I was very biased, and yes, hi, I'm Liz. I'm very biased. I have strong opinions. I'm a nurse practitioner, and I am very, very much on team nurse. So if you are here on team corporations should definitely be involved in healthcare and unions are evil, this might not be the video for you, because there's bias here, but everything is backed up with facts. I am not like elaborating on thing. This is the facts. I will link everything in the description down below for you to peruse. And we will be discussing, are nurses actually waking up and being the villains by asking to be paid 30% more than they currently are over 3 years? We'll discuss how that's a mess, and we'll go from there. So welcome, friends. Let's get into it. All right, hello, my night shift friends. Let's have some fun. If you're new, welcome. I'm Liz. I'm a family nurse practitioner. I have strong opinions, and they will be here. I also ramble. I got a lot of comments on the last one, be like, this person is insufferable and you ramble a lot. I was like, yes, I've decided I'm not going to apologize it anymore. It's fine. We are very pro the nursing union that is happening here right now. I'm going to review what the hospitals are saying about it, which made me want to like go into a rage. And then we're going to review some news articles, which made me want to rage more. Then we're going to take a look at, does this even like make sense in terms of like what they're asking for? And then we'll wrap up the night by playing some gaslighting bingo, because one email did happen to accidentally fall out of someone's email inbox and land in mine. So hooray, 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 hooray. A little bit of Monica. I'm a member of Minnesota Nurses Association, out on strike. Thanks for covering this. Well, thanks for sticking to your guns and going out and striking, Monica. I think that's bomb.com. Hello, everyone who is here live. If you are here for the replay, you may view the time stamps that will one day be in the description, or you can just stick around and hang out with all of us. We have a lot of our usual crew here. We have Chad, Mr. Midwife. We have Clayton, we have Rogue NP. Hello, thanks for being a channel member. If you want to get a fun thing by your name, you can be a channel member. It supports me and help me ran on the internet like this. I appreciate you. And all sorts of other. Scott took his first advanced pathophysiology exam today. How do you feel about it, Scott? Mama Nurse. Hello. Kimberly Davis. June Sam. Hello. I hope you had a good weekend. I did have a good weekend. It was very, very fun and exhausting. Jax Runner. Hello. And sorry I'm late. This was supposed to be 15 minutes ago, but my neighbor caught me and then was like very nice. And I'm really bad at leaving conversations. I got really good at leaving patients' bedside rooms and then my own office rooms at work when I had a patient that was chatty, but I've yet to figure out how to like signal my children that I need them to come save me. We're not there yet. We'll get there one day. If you have any way to train your children to be like, here's my secret sign. Like when I'm doing this, I need you to come save me. Do let me know. David Ramirez, hello, and thank you also for being a channel member. AP Nurse says, I can't wait to get pissed about people who have never worked in a hospital. Same. The amount of rage I unleashed at random people in the comment section, I was like, I'm here with receipts. Friends, don't fight me. Because you're all like, oh my gosh, you're really biased and worked up. I'm like, I have facts. You have conspiracies launched at you by the news. Go home. They were like, oh, yikes. And then some unfortunate people got like caught in the crosshairs of that when they were like, you ramble too much. And I'm like, not today, friend. Today was not the day to say that. Oh, I am, let me see, Montana gal. Hello. All right. Let's see. Oh, Stephanie, where if you are from the Minnesota area, do let us know how things are going. If you are involved, if you have any tea for us. And as always, second opinion, can you drop my email in the chat? And if you have any emails from these people, like if you work in any of these institutions, if you have any insider deets that happen to fall into my inbox and they could be anonymously shared, do let us know. We always appreciate when emails trip and fall into my inbox. Stephanie Pajari said, corrections nurse from Twin Ports. I stand with all my friends on the line. Yes. So today, and Clayton says, yes, I personally think more states should strikes. Yes, I think we have a lot of room to do a lot of things. So very brief rundown in case you are not familiar. In Minnesota, there are 16 hospitals in 7 healthcare systems and about 15,000 nurses that are striking, basically because they are in a union. They're in the Minnesota Nurses Association, and the union has deals. Basically, they have a set contract, and the contract lasts a few years, and that's what says, hey, you're going to get a raise of this much, and we're going to, this is what your holiday schedules look like. These are all the rules for what your job is going to look like for the next 3 years. The union comes together and the hospital comes together, and in the perfect world, they come together, they sing kumbaya, they eat cupcakes, and they say, that's a great plan. We can both compromise. We have run into a situation here where the nurses are asking for things that the hospital is like, no, apparently we're doing puppets. Scott says, how much caffeine have you had today? Scott, I don't want to talk about it. Okay. Take your shaming a lot. I'm on like 0 sleep for 2 days in a row. So a lot. And I'm mad. So we're here. That's the level. The unions and the hospital, they cannot agree because the hospital is all the nurses are asking for like, I would like to be compensated fairly. I would like to put like metal detectors in the hospital. So like we stop getting shot and the patients stop getting shot and the providers stop getting shot. And then we would like you to have more inclusivity in the people you hire. We would like you to try to keep people, so we stop having a revolving door of nurses because that's not safe. And we would like to have safe patient ratios. So we feel like we can actually do the job we were hired to do and it's safer for the patients. And the hospital basically has come back and said, maybe we can tweak your holiday schedule and we will try to hire more people that don't look like us. And that is pretty much where we've met. And therefore the nurses had to pull out their big guns and be like, fine, if you're not going to change your mind, if you're not going to do anything and meet us even like partway, which we'll go over what their version of partway was, then we're not going to come to work. We're going to pull out the one weapon we have in a union and we're going to strike. So the media is portraying this as if nurses just said, I want more money. And if you don't do it, I'm going to throw a temper tantrum, which that is not true, friends. That is not true. I will not switch to decaf. I won't do it. Don't make me in my dino mug. Don't make me. Oh, Alyssa, hello. And so what's happening during the strike? It started yesterday. It's 3 days long. Everyone go follow Alyssa's YouTube channel, Alyssa All Day. She's maybe my favorite internet. You are probably my favorite. You are my favorite internet human. She's the best. She has chickens. All is well. She also works in the OR, but the chickens follow her for the chickens. They're paying travel nurses like $13,000 a week in order to come in and work this, because obviously the nurses that work there are outside on the street. So not good. Let us take a look at what the hospital is saying in this situation because it made me so ragey. So now I talk at 50 billion words a minute and I need to calm down. You need to calm down. Hello, your favorite nurse. Hello. Yes, rant. I have so much rant in me. So much rant. Let me see. Exactly. Rogan P. Decaf. What is this abomination? I don't know. I don't drink it. It literally does not even live in my house. So let's see. I have 12 tabs open. Which one of them? This one. Evil. Evil, evil. So if anyone has any general questions, concerns, comments about the strike so far, it's going well so far as I have heard. No one had I did see a lot of stuff going around today that was saying that the Department of Health was going around and making like surprise visits in these hospitals. They're not surprise visits. That anytime you have a massive amount of people not going to work, the Department of Health has said, we're going to come in and check on things and assess for safety and see, is everything okay? So that is, if you see that going around, yes, the Department of Health did come in and they have been assessing, but they're there literally to, they had said already, like whenever, when all these people aren't coming to work, we're going to assess and see, are there any major events? Like, is there a huge safety issue? Because then I don't know, what would they do? Come in and shut down the hospital, say you can't run like this, but they are circulating. So there are people there to make sure that something looks even mild, like, is there any glaringly obvious problematic something going on here? So if you see that, it is, I wanted it to be like divine intervention, but they did announce that they were going to be doing it. So that's that. And here, so one of the hospitals that is doing this strike is apparently it's also sorry, when I get mad, my ADHD gets so much worse. Apparently, this is like the largest strike in history of a private entity, like private companies. So that's interesting. So if you're part of that, go you. And hopefully this sets an example that we can stand up for ourselves. So Twin Cities Hospitals, this is a place that owns a couple like different hospitals. They're all in the strike. This is the website that they set up for the public to be able to go and look at information, and also for their employees to be able to go and like look at information, but mostly for the public. So let's just see how they're talking about this. So shall we view the infographic? Let's, because it's rage inducing. Well, let's read the article and then we'll look at the infographic. Alongside nurses, we are committed to reaching a fair and equitable contract agreement for union nurses and our organizations. Except that's a lie, because the union tried to meet with these hospitals over and over again, and the hospitals refused. So they keep towing this other line of like, well, the union's not willing to budge. Well, you weren't willing to meet with them. So it makes it really hard to budge if you won't go to the meetings. So that's difficult. The union would go to the meetings because the union, that's like their job, is to go to the meetings. But a lot of times what happens, and I have experienced this in my own nursing union, is the hospital people that are supposed to show up don't go. So it makes it really difficult to negotiating. So I'm glad we're starting off with a blatant lie. It's the best way to start these articles. We need a contract agreement that allows flexibility to protect high quality healthcare the community has come to know and rely on. So basically, like, you rely on us, you need us. Here we are. Here's a general update on the contract negotiations as of September 11th, 2022. That was the day before the strike started. So this, remember, the contract is what the nurses and the hospital agree on, and it's a collective bargaining. So all the nurses are in this together, right? And that's saying, hey, you can have this many patients. You can only have so many patients on this type of unit. And here's what your raises for the next 4 years are going to look like, or however long their contract is. So nurses union rejects mediation. So our hospitals have asked the nurses union to join us in mediation to help reach a fair and equitable agreement. So this makes it sound like the nurses are not willing to come and meet with them, which is false. They want to have a separate mediator. So usually the way these things happen, in my experience, is the hospital has a team of people and the nurses have a team. The nurses hire, like through your union, they have the union reps that come and they meet together. The hospital wants to then hire a middleman to come and duke it out. So this makes it sound like in the article that the nursing union won't even show up to talk. No, the hospital won't show up to talk because the hospital wants to use a middleman, and the union is like, no, like this just is wasting our time. Let's just fight it out. Like if you won't give us the solutions, that if you aren't willing to compromise here at all, what's a middleman going to do except cost us more money and waste our time? So when they say that, and which you'll see all over in people arguing on the internet, is, well, the nurses wouldn't even come when they wanted to mediate. No, they wanted to do a totally different thing. So lies. And equitable agreement. A trained mediator can help parties focus on the key elements needed to move forward together. However, the nurses union has rejected all of our requests for mediation, basically because you should be able to do this without one. Like, you don't need one. This is the same type of thing. Like sometimes when you're getting a divorce, you have a mediator instead of like going to court. It's basically someone who's going to like help you come to an agreement. And you don't really want to necessarily take too much of an agreement on patient safety issues. You know what I mean? Like you're like, no, like these are a lot of things we don't want to budge on because it's common sense and common decency. Like, no. Non-economic issues, workplace safety. Every hospital employee deserves to work in an environment safe for employees. True. Patients and visitors alike. Yes. Several hospitals, no, not all, several hospitals have reached tentative agreements with nurses unions on revised workplace safety measures. So now they're going to tout like what the hospital has done. They're like, so the nurses won't have this other mediator person. And we have been willing to, in some of our hospitals, improve safety measures. Not at all of them, but at some of them, we are willing to do that. Working together, we're all committed to safety. So good. We might install some metal detectors because a lot of these places are having a lot of issues with people coming in with weapons and threatening the staff and other patients. So you might understand that this would be a priority, but only some of the hospitals apparently have gotten to that point. Okay. Diversity, equity, and inclusion. Several, not all, we're trying to get all of them on board, but several hospitals have reached a tentative agreement with the nurses union on practices related to diversity, equity, and inclusion in the hospital. So some hospitals have even decided to hire people that don't look like their board of directors. And I've looked up their board of directors, and their board of directors looks about what you would expect, and it's not very diverse. So I'm glad. I am glad that some of all the things they've been asking for, because let's remember, if you haven't seen my previous videos on this, I'll leave them linked down below. The big things the nurses are asking for is they would like safer patient ratios, they would like safe in work environments, and they would like to be compensated appropriately. They would like the raise, the 30% over 3 years, which don't worry, we will go over why that does make sense, because it makes sense. It's not people being greedy. It's literally just asking them to like keep up with the times. So I'm glad out of all of those issues, they picked two that were like, these should happen anyway. Like this should be a non-issue that we are like hiring a diverse, equal population. And maybe you should keep me from being shot when I come to work. And they've been like, yes, we will meet you in the middle there. We will consider that at some of our hospitals. So that's where we are. Economic issues, wages. The nurses union initial wage demand. So just like the little digs that they put in there, sought to increase wages by 39% over a 3-year contract, which is why I put 39% in the thumbnail. Now they're asking for 30, but they originally said 39. I figured it was a little bit more dramatic. And if we can get a few other people to click on it because they're like, wow, 30 doesn't impress me, but 39 does. We're trying to get the public mad because this is how we're going to change things, right? And we have a right to be mad. And nurses are mad, but we're trying to get other people mad. Okay. If you're watching this, I want you to be mad, and it's for a just cause. Get mad with me. 39% over a 3-year contract, compounded more than 44% over the contract's life, because it's going to like build on the number before it. As of September. And that means like 1 year, it would maybe be like 10%, and then like whatever, 19%, and then 10. Does that equal 39? I hope so. As of September 11th, the nurses' current wage demands remain between 27 and 30% over 3 years. So they have come down and said like 27 to 30% is even fine. Increases like this would cost hundreds of millions of dollars across the Twin Cities hospitals and are not economically feasible or responsible to our community members who would ultimately pay the price. So here they're making the public statement that the nurses want more money. They wanted this absurd amount of money, and now they want this amount of money, and it would simply harm you. So we can't do that. Like, look at how the vibe I get is very much like, look at how unreasonable they're being. Are four of the hospitals who are four of our hospitals. Proofread, my friends, proofread. I'm just going to say four. They probably meant four of our hospitals have responded with fair and reasonable opening wage offers that reflect percentages found in the most recent agreement. The nurses overwhelmingly ratified. So they're saying, if you look back at our last one, the last contract that we set up, this is it's better than that one. So you should be happy with it. These opening offers reflect between an 8 and a 9% increase over the 3-year contract. So maybe like 3%, 3%, 3% every year. And they're saying, this is what we did before, so this should be fine now. So they're building themselves up, saying like, we're being more than reasonable. Look at us, what we're offering you. Since the opening offers, our hospitals have proposed increases between 10 and 12% over 3 years. These proposed increases are an additional step to increase nurses receive an approximately 3% average. These proposed increases are in addition to step increases nurses receive that add approximately 3% on average to a nurse's pay. Okay, so that is a step increase is if you go up a level. So if you do extra things, get a lot more things after your name and join leadership committees, you can become like a registered nurse level 3 or level C, and then you get a little bit more of a raise. Basically, we anticipate further negotiation over wages and await nurses union response to our wage proposals. So we have the nursing union saying, hey, hit me at 30% over 3 years. And the hospital's like, how about 10 over 3? And okay, well, the next thing. Nurses, this is where I got so mad. Nurses in Minnesota rank among the most highly compensated in the nation, regularly in the top 10 amongst all states. So they're saying you already get paid well. The average Minnesota nurse earns $80,960 annually and receives generous healthcare and pension benefits. So we give them healthcare, and nurses in our state tend to make a lot of money. Mediation, the nursing unit seems intent on rushing into a strike. So this is what they're putting out there. This is what the hospital is putting out there. The nurses are rushing into a strike without first exhausting all options to reach a fair and equitable agreement. The union has steadfastly rejected multiple requests from the hospital to join in mediation. Again, mediation is not the meeting. Mediation is using a third party, adding in the middle. So it is actually the hospital that has refused to meet with the union. Mediation brings in a neutral third party trained to help parties reach an agreement. So the union doesn't think they need that. They're like, why don't we just meet together like we're supposed to? And that's where we're at. Now let us tear this apart briefly. So 30%, when I first read that, I will admit, I was like, 30% sounds like that's like a lot. That's going from a good amount to we're going up. And then I started to think, I'm like, I wonder where they're getting that number. And that was when things got very, very interesting, because I was looking at it, and 30% over 3 years would pretty much exactly mimic cost of living raises. So if you look at the cost of living adjustment, you will see that let's just stop sharing this one and share this one. Maybe. Pending. Perhaps. Share. There needs to be a quicker button for this. Oh dear. We need music. For like, where can Liz find? Here we go. Can Liz find the article? Okay, so cost of living adjustment. This is based on, they got this from like the Department of, I don't even know, Revenue Services, something, whoever decides the cost of living adjustment. And that website was very confusing. I found this one and it's prettier, so we're using that. But the numbers are the same. I checked them earlier. So cost of living raise is when people are giving you a raise just to match inflation. So they're saying, hey, your $20 an hour you earned last year no longer is worth the same as $20 this year. So we're going to just increase it. You're not actually getting a raise like, oh, you're doing a great job, let's give you a raise. We're just literally keeping up with the times, right? Yeah. So they, if you look, they said, oh yeah, we've been giving raises of about like 2-ish% a year, which that was fine. That was nice. When the cost of living increases were in 2018, 2%. In 2017, 0.3%. Whatever it averaged out to, it was like, oh, okay, like this kind of makes sense. You know, it was 1.3%, 1.3%, 1.4%. So giving someone between, I think it said like a 1.5% increase, it was like what it averaged out to be, that is what they had been giving. However, we then arrive in 2022 when the cost of living adjustment went up to 5.9. Did the hospital give them a cost of living adjustment of 5.9? No, it stayed at the 1.5 or 2% mark, whatever it has always been. So immediately we're already behind, right? Because it's like, well, now we're behind, so we're not quite making up for it. And then we look and we say, what is it projected to be for this year? Because this is a mess. Because this year it is looking like it is going to be over 10%. So if it's over 10% and we're thinking we're already behind, we're over 10% this year, and it usually stays that way for like a few years because we're not anticipating this is going to get better. That would be 30% over 3 years, friends. So that's what they're asking for. So that number, while it initially might have seemed like, wow, 30% over 3 years, that's not good. That's not like wild anyway. You know what I mean? Like they just are making it sound like this huge number when really like it's a cost of living adjustment essentially that they're asking for. And the fact that the hospital is like, let's meet you at 10. It's like, friend, that's what you're supposed to give me just this year, not over 3 years. And in case you're like, but Liz, that doesn't seem fair because what if the poor health system just can't sustain that? Okay. They just might not be able to sustain that. Well, to that, I say that's interesting. Let's look, have they increased anyone else's salaries? Have they managed to be able to give anyone else a salary increase that was above 2%? And as it very interestingly turns out, they have. So they have been able to give raises of large percentages to their CEOs. So Fairview Health, James Hereford, CEO, he got a 90% increase in 2018. And if we remember, where were we in 2018 with all of the other nurses? Because yes, 0.8. So he got a 90% increase in salary when everyone else got 0.8. So that makes sense. I'm sure James is doing 90% more work than all of the nurses. Good. His salary is 40 times more than the salary earned by the average registered nurse in 2019. I'm sure he's doing 40 times the amount of work. That makes sense. And this isn't just at this hospital. Children's Hospital, Minnesota, that's one of the ones that is from this actual letter. He got a salary increase of 47% in 2018. Essentia Health CEO David Herman, he got a 61% increase to 2.7 million. And these are all in the millions. CEO Penny Wheeler at Alena Health, she got a $2.67 million. She's going on that type of a salary. So it seems like the nurses don't necessarily always get they don't always get the pay increase, but interestingly, like the CEOs and the C-suite is getting all of the pay increases. So that's funny how you're able to somehow allocate that to them but not anyone else. Shall we go back really quick and just see some of the other stats that they provided in this little article, because it's a lot. Let's share this. And I see some of your comments. I'm going to come back to them, I promise, but I feel like I need to get my thoughts out on this so that I'm not all over the place, and then we'll read them. We'll do this in chunks. Thanks. You know how my brain is. Okay, so we've debunked most of this. So 30% over 3 years is literally just the cost of living. And I think it's very fair that nurses should be allowed to have a cost of living wage. That makes sense to me, at least. Like, I'm like, hey, this is your job. You should be compensated fairly. in accordance with the inflation that we're experiencing. Interestingly, enough, the hospital is also charging more for all of their services because of inflation. So they're bringing in more money too, but they will blame the nurses for this. We'll see. I'll show you. It's annoying. So then they come over and remember how they said nurses in Minnesota. We're going to look at this next. Nurses in Minnesota rank amongst the most highly compensated in the nation. Who cares? Who cares? Clearly, the person who wrote this, I don't even remember who. I don't know. I don't even think they bothered to put their name on it because they were embarrassed. That's great that overall nurses in Minnesota make more than people in all the other states, but it doesn't matter, you dumb, because you only need to look at the state of Minnesota. You really only need to look at the geographical location of your hospitals and compare within that demographic. Okay? Because if you look at the average nurse that is in Minnesota, that tells you nothing. Like you're like, oh, well, you make more than someone who lives in Idaho. Well, that's great. The cost of living in Idaho is different than in Minnesota. And you want your nurses to make the market average for your location. So why are you making it seem like, oh, well, you already make more than the average nurse in the country? Who cares? It all comes down to where you live, because in statistics, I hate statistics. I'm very against nursing theory taking up so much of our lives, and it's a waste and it's just a blight on life. However, maybe we do need to focus on it more, because whoever wrote this has no idea how statistics works, because you need to apply the number you're working with to the population you're looking at. So you can't say you make more money than everyone. No, they make actually less than the state average for Minnesota at this in this area at these hospitals. So false. Who cares? So we can just throw that out. So then they give you this wage comparisons chart, which is useless because it literally goes through all of the different states and it shows you that, oh, look, we are, we're just as fine as everyone else. This is, we're going to give you, we're averaging out with the other states. And it's like, it doesn't matter what the other states are. It doesn't matter what the other states are. And then there's an even more infuriating point. Let us look. So this is the thing that they gave us. They were like, here you go. The federal nurse, they were like, look, we're even going to include the cost of living average salary comparison, because they're saying, yes, you should be given a cost of living wage increase. And when I saw this, I was like, oh, that was bold of them to put on you. Oh, it's from 2021, because 2021, the cost of living raise was 1.3% or something. So I was like, oh, well, that makes sense, because we already have the 2022 data. And you remember that 2022 is when it went up 5.9%. So they did match the cost of living wage increase so we're at 100%. They're saying the 2021 state COLA index. So how far behind are you are you keeping up with inflation basically? And 100 would mean, yes, like you're matching the state and like the country's inflation, but they gave you the 2021 date, not the 2022 date. And why did they do that? Because in 2022, they were many, many percentage points behind. So they didn't want to include that on there. So they're trying to show you like, hey, compared to the rest of the country, like we're doing like, okay, even though a lot of these numbers are above 100. So they're really not, they could be doing a lot better. But yes, they do rank as one of the top paying in the country. But again, that's not the population we are looking at this data for. And you gave us information that's a year old and no longer proves your point. You used old data to make yourselves look better. So that's embarrassing. So now that we've debunked that little fun part, they gave you this nice infographic, which just basically goes over, that they want all of this money. A nice little thing that they're probably going to post. I don't know. On your whatever. Are they posting this? If you live in Minnesota, are they posting this? Like, it looks like something they made to like put in their hospitals. So when people ask about it, or that they could like email it out to patients, like this fun little infographic, which really just slams their nurses. And I thought this whole thing was honestly just gross. The whole way they wrote this and that this is what they sent out into the community was like, disgusting. And Nurse Scott, yeah, this is complete cherry picking of their data to make nurses look really, really bad. Also, remember how they said the average wage in Minnesota, like, yeah, the wages are just lower. It just doesn't, it gets me so mad I can't even like speak. They're cherry picking information to try to blame all of this on the people who are affected by it, to make the public mad at the nurses instead of the public mad at the hospital. And it is not nurses' jobs to take less money in order to fix the problem. I understand that healthcare costs are ridiculous. That's literally why I can't work into like in the system anymore, is because it broke my soul. Like not being able to provide care for my patients who desperately needed it because they could not afford it. So I get it, but I hate how they're trying to now take this and say, "Hey, rather than taking a look at our system because the system is the problem, let's just blame the nurses who want more money." The nurses who have been the ones going into work through the pandemic when all the administrators stayed home, the ones who are on like there every single day trying to make things work, even though there is not enough staff, the ones who are getting the brunt of all the patients' emotions because there's not enough staff and they're not getting the care that they need. So everyone is mad at nurses everywhere. Nurses are mad at nurses because some of the, travel nurses are getting paid a ton of money. Nurses are mad at nurses because we're quitting because no one wants to be there. They're like, "No, I'm not going to take this anymore." And so the public is just flipping it like the hospital is completely blaming it on the nurses instead of looking at the problem. And the problem here really, really is we like the healthcare system itself because it's built for profit. Like they say it's a nonprofit, and we will do a video one day on what nonprofit is and how it's like total BS. Obviously, if you're making millions and millions of dollars as the CEO, the profit's going somewhere. But the problem is when we're running in this setting where we are a for-profit healthcare system and we run on insurance, at least 20% of what everyone pays into the healthcare, like all of your costs when you get that extraordinary medical bill, at least 20% of it is just going to administrative costs only for insurance. So like we're just throwing all of that money away, which does not help with the inflation costs of everything. So it's not the nurses who just would like to be paid. It's literally that we're throwing away almost a quarter of all of the things we pay into healthcare just to figure out insurance, because you need the people who are going to take the insurance at the front desk. You need the people who are going to do the billing and coding to make sure you bill, you get the right words down when you are charting as the provider so that you can ask them to pay for it a certain way. Otherwise, they won't pay for it. You have all these quality people who are coming in and checking, like, did you chart this the right way? Did you word this the right way? You have whole teams who swoop in to collect the information from the patients about what kind of insurance do you have? You have other teams that are all trying to figure out, how is this person who's saying they can't afford this, what kind of payment plan can we offer them? You need to have a whole customer service department of people coming in to be able to navigate the calls of people being like, I can't handle this. You need to have entire other teams of people who are going to care coordinate and figure out, okay, let me try to find somewhere that you could afford. Let's compare prices. And countless hours of your provider's times and of your time is dealing with, where can I find this and how much is this? Like, we waste so much money on how our healthcare system actually works, like on the administrative side of insurance. And that, if we all got mad about that versus getting mad at nurses who are literally just trying to do their jobs and get paid for it, which is a very normal thing to ask for, and ask not to get shot at work, and ask not to be punched at work, and ask to be able to be like, hey, you have to give me the right number of patients so I can do my job. Rather than getting mad at nurses, if we all got mad at the system and said something has to change, we need to change this. Like it has to, something has to give here. We're wasting so much money, so much resources, and no one can even access care because one of the biggest things that leads into our healthcare costs being so high is patients can't afford to access care in the beginning when they stub their toe, right? Say, let's have a patient with diabetes and they stub their toe and it gives a little scrape. They might not have access to primary care because their deductible is $8,000. I saw this every single day. like literally every single day when I worked as a primary care provider. They wouldn't come in when they stubbed their toe. And they weren't taking any of their medicine for diabetes. They were supposed to come in and see me every like 2 or 3 months because they were their blood sugar was, it's really not well under, like, we don't have a good handle on it. Their blood sugar is super high. They're very sick. They can't afford their medicine because they have a high deductible plan because they make just over whatever the poverty line is so that they can't qualify for Medicaid. And they cannot apply for, they don't get Medicaid, which is through the government insurance. They also, only thing they qualify is like a high deductible plan that they're paying still thousands of dollars into a year through the Affordable Care Act, or through their employer if their employer offers it. But they don't get anything until they hit their $8,000 deductible, right? So they don't go to primary care because every time they do, it's it's like $150 or $100, and they don't have that. So they wait, they stub their toe, they're not on their medicine to help control their diabetes. And by the time it gets so bad that they show up at the emergency room, because this is what happens with diabetes, you can't feel like eventually you get nerve damage because this disease progresses. So I would have all these patients show up in med surg when I worked there, and their toe was gangrenous, which means it's dead, essentially. Now their whole foot has great gangrene, which means it's rotting. And we would have to chop off their entire leg from a stubbed toe that didn't get taken care of at the beginning. Has now turned into, oh, wow, you're rolling up into the ER with gangrene. You might die. Let's chop your leg off. You're now going to be permanently disabled. You are going to require, you can apply for like a lot of people would end up on disability. A lot of people would require rehab for the rest of their life. They were now going to have to take all these other medicines. They were at risk for a whole bunch of other stuff. They were going to have to go stay in rehab. They had a hospital stay. They had a hospital bill that was thousands of dollars that they could not afford. So they ended up filing for bankruptcy. The hospital got absolutely no money from any of this. And that is why our healthcare system is unaffordable, is not working, is because that is what we need to get mad about. Raj says I'm going off on a whole tangent. No, this is like all tied together. That's what we need to get mad at, not nurses. The fact that this is happening, like, that is what I want to get people mad about, not nurses wanting to be paid. Because a huge thing of this is a lot of people are pushing that this is the nurse's fault and they're just greedy and they want money. And the hospitals are saying, no, it's the nurse's fault. And it's like, no. And it's not completely the hospital's fault. It's the fact that we let this situation get to this point, and like, we need people to get mad about it. You know what I mean? And like demand change and vote for change and be like, no, like this is not going to work for me anymore because it's not working. Like the way we have it, it's not working. And we can leave. I won't go into a whole tangent on what I think would be a good solution. We can leave that for a very different time. But I think we can at least all agree that the system, the way it is not working. And I think we're hitting a point where we're saying like, no, I'm not going to take this crap anymore. Rogan P, exactly. We want to be treated with respect as valuable members of the healthcare team that we are. Exactly. So stop getting mad at me. And this is very poor timing, I think, because it's coming off of the pandemic and suddenly everyone liked nurses and now they're all mad. It's like, oh my gosh. D Spirit said, we have so much on our table as they keep working it as distracted and they get away with evil. Yes. The healthcare system is toxic. Yes. Like the video if you agree that the healthcare system is toxic. We'll take a brief refresher and we'll go through some comments because that was my main monologue spiel. I have other things we're going to look at, but I got my soul out and I feel, better now. So, well, not better, but I wanted to try to get that out in a way that like made sense. And that is where I feel like we should be focusing most of our anger, is that way. At the whole system that has created this mess versus blaming nurses who are just tired and exhausted. And as Second Opinion says, remember, we're all about discussion from all sides here. Just be polite. Yeah, we do not have to agree. I am very, very pro, I think healthcare is a right that every human should have, and we should have like a universal healthcare system of some sort. And you don't have to agree with me on that. We will have that conversation one day. But I think we can no matter what, just agree that the way these hospitals are approaching this strike and blaming nurses is disgusting. I mean, I guess you don't have to agree with that. And yeah, Chris Fleming said the procedure-based system. Oh, I accidentally. Oh, here it is. The procedure-based system is a huge problem, and the system needs to be refocused more on health outcomes for patients. Agreed. But that can't happen in a for-profit system. Exactly. A system that uses sickness for profit will never succeed because it's by villains. It's made by villains. Maria B said, this is a topic I've been screaming about for years, and I'm so sad but happy to see it coming for the public to see. And I agree. I wish people don't know. Like, they genuinely don't know. I'm that awful person at parties when people like get stuck with me and I rant about this. And most of the time they're like, what are you talking about? Like, what? That is not happening. Nurses don't have like 8 patients. They're not like all of this. Like, no, none of that is happening. Like, what? And yes, it's happening. So I'm hoping that as things like this happen, which is why we're making videos like this, it can help burst that bubble a little bit and be like, oh, like this is a problem. This is happening in our education system because nurses and teachers have been lumped in together here. I've gotten so many comments so many comments about nurses being just like teachers in that they're just in it for the money, which is like hysterical. Like, who would want to be a nurse or a teacher for the money? Like, nurses were cleaning up poop, and teachers, like, I can barely handle hanging out with my own children for a few hours. I cannot fathom hanging out with 30. I was an elementary education major for 1 semester. I got to my first day of like classroom observation, clinical type of thing. I immediately went home and told my advisor, I was like, never again, never. I love children, but I would love to take care of 3 or 4 of them in a hospital, I think. Let's go that way. So, interestingly, I do find it interesting that the public seems to be turning against nurses and teachers who are in unions, because I've seen a lot of comments on that on like TikTok and everything else. And I think they're attacking nurses and teachers because we're seen as more of like the giving profession. You know what I mean? Like, oh, I'm going to like give a little bit more. You're doing this out of the kindness of your heart, which is stupid. This is a job. We should be compensating. But I think it's because it's primarily female, if we're being like totally honest. In the US, only 20% of union workers are teachers or healthcare workers. Okay, so only 20%. However, if you look at, and most teachers and like nurses right now, like just statistically, tend to lean more female. And if you look at so it's only 20%. So there's 80% out there. The other ones are like people in the entertainment industry, like movies, theater, all of them usually have unions, people in transportation, pilots, people driving buses, trains, things like that. And then services for the city. So things like utilities, a lot of them are in unions, things for like, electricity, plummet, like all of those municipal type things are usually in a union. A lot of those are more male dominated. So who do we hear? Who do we hear? And yes, thank you, Nurse Adrienne, public workers. Who do we hear the most complaints about? It's the nurses and the healthcare workers. No one is saying, you stupid pilot, you should be honored. You should be honored to be a pilot. Stop demanding more money. Stop asking that you have fewer hours. Stop asking for safer working environments. You need to stop that. And it's interesting that it's only the ones that are primarily female dominated that are like, why don't you just want to work more? This should be a calling. This should be something that you want to do out of the goodness of your heart. And you should actually pay. You shouldn't take the raises. You should pay for these things if you want them, which is what we do to teachers, right? We do that to teachers when we say, you want classroom supplies? Well, you can go and buy those. And if you're confused, I got many, many, many comments like this. They're striking over pay. So this is on my video from 2 days ago. Nurses are striking over pay, but yet their signs say patients before profits. They don't care about their patients. It's all about pay. Hypocrisy, which you're allowed to want to get paid in correlation with inflation. That's totally fine. And 2, If you pay nurses, they stay at their jobs and that makes them safer. They also would like safe staffing ratios. And we know that for every patient over the safe staffing ratio, so say like one nurse for 4 or 5 med surge patients, one nurse for every 2 ICU patients, there's a 7% increase for every one extra patient a nurse has, that something bad will happen to that patient and they will die or have a complication. 7%. We're seeing people who have 4 extra patients. That's literally asking for a quarter of your patients, like for someone is going to get hurt. And so it is patient safety. Is it also nurses being able to do the job that they were told to do? Yes. But it does come back to patient safety because the two are kind of hand in hand. If you treat your nurses nicer, you have better retention, which is what they want. They've said that over and over. We just want you to like be decent so we stay. And if you keep people, they're safer because they're used to the unit. They have experience instead of turning everyone over and having new grads constantly. No offense to new grads, but you need the other people there who have the experience so they can teach the new grads. Right now, it's new grads teaching new grads. And that's not necessarily the safest, right? You need that person who's over in the corner. And when all chaos is happening, they're just like super casually like striding over. And you know, if that person ever looks panicked, the world is ending. You need that person on the unit to be your stabilizer. So, Eddie, you're wrong. And then I came back with like, actually, they're just asking to keep up with inflation. I said, okay, so inflation is affecting their patients as well. How about a strike about inflation, or how about the price of medical care? But instead, they want more money. Just be honest. It's not about the patients. It's about their own pockets. Again, Eddie, no one goes into nursing. Like, is it a stable job? Yes. But if we wanted to make money, we would have gone into something else. Okay. At least when they are being honest. My problem is not with the nurses. My problem is with the lies. This strike will do nothing for patients, as they say. Yes, if there are a better nurse to patient ratio, Eddie, you will be safer. Duh. Watch in 5 years, hospitals will be all overpriced and not have better security. The only thing that nurse changes, nurses should be making bank while the patient is still getting the same care and experiences they do today. And I totally understand this person's frustrating because the prices of healthcare are ridiculous. That is my other biggest pet peeve in life. I'm with you, Eddie. I feel you, but we're targeting the wrong person. And they are going on about this is just like the teachers' strike. They said it was just about the students, but in 5 years, Minneapolis students will be failing, and the schools will still be a crap show, but the teachers will be all good. I don't think teachers are all good, friend. I don't think they're all good. Not to mention, there'll be another teacher and nurses strike next year after that. And then he went on later to tell me that instead of getting raises, nurses should just not take a 30% raise, and we should pay for the metal detectors out of our own pocket because that is, if we really wanted it, that is what we should do. And I was like, what? And that I have seen over and over and over again on other people's pages. I don't know who is spreading that bogus nonsense of, if they really cared about the patients, then they would just cover these things out of their own pocket. I shouldn't have to pay or not get a raise because I want a medical detector to keep me from getting shot at my job. Yes, Montana Gal, they want us to be getting paid in hugs. They do. They're like, we'll do it for the patients. No, I'd like to do it for the money. And this is ridiculous. Absolutely ridiculous. Rogue NP says companies used to recognize and respect the workers who were loyal and who retained, like you got pensions. Exactly. Now retention is no longer the focus. Recruiting is. And Meaningful 22. I so appreciate you. Thank you so much for the super chat. Let's also talk about how the purposeful suppression of nursing wages that has been going on for decades. Yes. So they call it the big raise they gave them would not even compensate for the lost wages in retirement. Exactly. They have not been keeping up with the times in terms of like how much money you made then versus now. So we're like very behind. Because they keep playing the card of like, well, this is like a calling, like you're so privileged to do this, basically, is what they rely on over and over again. And then they use that, they gaslight the heck out of you. And they say things like, well, what would we do if you don't do this, your patients will die, which pulls on your heartstrings. And you're like, yes, I'll fight harder. Yes, I'm exhausted, but it's fine. I'll just pull my ish together and we will show up and we'll do this thing. So thank you. I appreciate your super chat. You're the bomb. But yes, We need to talk about money more, and we aren't good at talking about money more. Not that this is like absolutely a absolute, but like usually women, we're not always as good as talking about money as dudes who walk in and they're like, no, this is unacceptable. Just having heard how a lot of dudes have conversations about money, I'm like, wow, that I did not realize that we could just come out and say that. Like, no, I'm going to need more money. So yes, ladies and gentlemen, everyone, we need to do this. And Maddie, oh, thank you for the super chat too. I appreciate you. Social workers are treated similar to nursing and teachers, although female-dominated professions, also a female-dominated profession and very low pay. Yes, any type of giving profession, I have tended to see. This is going to go with therapists. This is going with anybody who could be manipulated into like, wouldn't you just do this for the good of your patient, are going to be affected by this. And it's crap because, like I said, we do not see people pooping on union members and union strikes when it is not a female dominated giving profession. So, very interesting. Very, very interesting. I'll take off. I was going to say I'll take off my tin hat, but it's not even like a tin hat because it's a mess. AP Nurse says the public is woefully ignorant to healthcare. They are. And it's like not people's fault because there is so much money being pumped into like suppressing. Hospitals don't want you to know how that sausage is made, right? They don't want you to know. People don't talk a lot about their lack of access to healthcare. I had no idea until I worked in primary care how screwed up all of this was. We just don't talk about it. And a lot of the people who are, sending all of their money into like lobbying, hospitals pay millions of dollars into lobbying to keep things how it is. Insurance companies pay maybe billions of dollars into lobbying, into keeping things how it is, because that's an entire industry. You know what I mean? So there's a lot trying to make sure that people are ignorant. So it's not people's fault. It's just our fault to get mad and tell them about it. We still need to figure out a slogan for that sounds less bad than just get mad and burn it to the ground. We need a better slogan. We have Head, Hand, Heart by David Goodhart is a good book that talks about all these same issues. Oh, awesome. Second opinion. Will you write that down? These are W. Wardo said they are entire floors at my hospital that are entirely new grads. It's ridiculous. Yeah, that's not safe, friends. So if you want to retain people, if you would like to retain people and keep people safer, please do this. Please just pay people, because otherwise they're going to go to the places that will pay them. Chris Fleming said they would rather just recruit new nurses at lower rates than retain the seasoned nurses who get paid more. But that's without seasoned nurses to train new nurses. It becomes a potential safety issue. Yes. And yes. So therein lies, therein lies a lot of our struggles, right? And it would save them money in the long run if they just looked at it and they said, oh, like, how could we like do this? With saving money in the long term, but they don't want to look at it in the long term. They're like, well, this quarter, because again, we're working only on profit. So they need to make money. So they're going to cut the things that don't make them the most money. And Rogan P is right. Nurses get blamed when things don't go perfectly. We don't work with numbers or computers that can't talk back or refuse to cooperate or attack you. We work with people who are unpredictable. Unpredictable. Yes, with people. And yes, it is. And we are generally not good at standing up for ourselves, because we will usually make excuses for, yes, I will come in and cover that overtime shift, because when the manager texts you and is like, hey, your friends are sinking, a lot of people are like, they are my friends and I don't want them to sink. Or, hey, can you just stay for another 4 hours? We literally don't have anyone to follow up on you. So if you can't stay, we might mandate you and you might be here. Or we're going to divvy your assignment up to all the other nurses, and they already have 8, which is unmanageable as it is, and they will just have more. So a lot of people get manipulated into situations because the system it's not working and it's unpredictable, and nurses are the one filling the gap and making it work. Underpaid Nurse said there's a great speech done by the owner of Mule Designs called F You Pay Me. It's eye-opening. Exactly. I've had many conversations like that. Yeah. I got a DW said I got a 1.5% raise, but my insurance went up 2%. Do they think we can't do math? I really think they do. I really think maybe they think like the pizza. They're like, wow, I would be mad about this, but you did give me a pizza party. Well, you technically gave Days a pizza party and I worked nights and there was 2 leftover slices that we fought about and like scrapped over. And I didn't get one, but Julie said it was really delicious. So uh, hopefully that definitely makes up the difference for that. We'll come and see. Yeah, firefighters and police don't get called off when crime and fired are low. Yeah, no, they don't get called off when crime and fires are low. Exactly. And that happens to nurses also, where, oh, you have short sentence, like you don't have as many patients. Well, you aren't just going to come into work. Yeah, you're not going to get paid. Like we don't treat other professions like we treat nurses. We need help. Okay, let us see what other shenanigans there are. The strike overall, the status of it is going well from what I can see. They seem to be there's a lot of people out on the streets. They're picketing, they're spreading the words. The hospitals are obviously like kind of freaking out because they're setting up statements like that where they're shifting all the blame to the nurse, which why would you even want to work in a hospital anymore like that? If you are one of those nurses, if that's the way the hospital is talking about you, like literally just spewing lies. So that's a hot mess. And let us see. A lot of the media looks like this. We can just take a look really quick and see like how they're framing it. And we can get a little bit more enraged and then we'll do some bingo and then we can go to bed angry. I might need to have a beer. I definitely need to go have a beer. Largest private sector nurses strike in U.S. history begins in Minnesota, the Washington Post. So this one, it's going on. 15,000 nurses walked off the job on Monday to protest, which again, they just make it sound so like casual. Like they just decided they weren't going to show up, marking the largest strike of private sector nurses in U.S. history. Go Minnesota, you did it. Slated to last 3 days, the strike spotlights nationwide nursing shortages that got worse, by the coronavirus, and all the nurses are quitting. Not ideal. 16 hospitals were expected in 7 systems. The nurses are demanding, again, phrasing it as nurses are demanding rather than just like the nurses are showing up and expecting to be treated decently. They're demanding roll-in staffing plans, changes to shift scheduling practices, and higher wages. They interviewed some people who said call-outs are going on and start. I can't give the care I need to give. They've kind of backed us up against a wall and our choice is to strike. This wasn't like not thought out. This was the choice that we had to make. The Minnesota Nurses Association, the union said hospitals administrators have continued to refuse solutions on understaffing and safety negotiations in the contract. It said that nurses have been increasingly asked to take on more patients, more bedside care to make up for shortages, exacerbating burnout and higher turnover. So you're literally, you're doing the exact opposite thing of what we would like you to do. The unions have proposed new mechanics to kind of say like, hey, this is how we could have better staffing. This is what would improve retention. And the hospital's like, no, thank you. Striking nurses at some hospitals said their shifts are often short 5 to 10 nurses. I mean, that's like if you think 5 to 10 nurses, each nurse is taking like 5 patients. That's 25 patients that you're now trying to split up against people who also have the same number of overwhelmed patients if your staffing's even at 5. And it's a mess. Hospitals facing strikes have been recruiting travel nurses. There's a lot of rage about like, well, why are they spending, it makes no sense if you look at it. The hospitals are paying so much money to bring in travel nurses. And then they're having to pay to like $13,000 a week. You're willing to do that? Like what a slap in the face to nurses. You know what I mean? That work at these hospitals, that they're willing to pay for all of that and not willing to just like be decent. You know what I mean? Just be decent. Nurses are quitting. It goes on about this. They're saying that the strikes could spill out into like other states. Basically just, it goes over the union wage demands 30%. It goes and it spits out a lot of the same things. So this was the part of I was like trying to figure out, I was like, why did I include this? What was this? This was showing you that in the media, they're picking up what the hospital is posting about like that. You know what I mean? I'm glad I figured that out. I was like, why did I do this? Why did I? Angry Liz earlier was just like copying and pasting. And here we are. The media is now picking them up. So the Washington Post, I think, is that a national thing? I think it's a national thing. Also, Joan Jensen, thank you so much for the super sticker. I appreciate you. I like the lemon laughing. If you can't see the lemon laughing, let me try to put it on the screen. Can you see the lemon laughing? You might not be able to, but it's very cute. Thank you. I appreciate you. The media is picking this up and they are saying, hey, look, this is the story. And this is the frustrating part because they're just picking up what the hospital is saying that we read at the beginning of the beginning of the rage session. And they're saying, look, they already make more money than average. They've been in negotiations since March. They're frustrated. You know, nurses are frustrated, but the stakes are high for them and their patients. Remember, don't forget the patients were really sad and disappointed that it had to come to a strike. We feel like this is the only thing we can do. But, you know, again, you're letting this happen. And thanks. Not very helpful, right? So that's what they're reporting in the media. So that makes me feel good inside. I'm like, why didn't you ask nurses to go on the news? That's interesting. Nurse Adrienne also she has to go everyone on Twitter and hashtag those news outlets to let them know the truth. Yes. And Nurse Adrienne had a good point the other day too. You can follow her on the Twitters, the YouTubes, and the Instagrams. She's the human that knows all the things about the strikes and the business side of healthcare. She is that lovely human in our lives of sending out your own resume if you're willing to talk to healthcare places in your area to be that resource point, to be like, hey, when things like this come up, rather than posting these random lies, why don't you come and ask us and maybe we can give you some insight? So just emailing it and literally being like, I'm more than happy to be that person for you. I might not know everything about it, but maybe I will. And I'll be able to give you some actual information because sometimes people in the media, like literally, they might just not have access to other humans. And who's going to absolutely talk to them is the hospital. Okay. The hospital will talk to them and they're going to send out PR statements like that. And they're going to pick them up and they're going to be like, well, this is, here we are. Michaela said, I think the Washington Post forgot to do the fact checking because most of us I know don't make 80,000 a year. Yeah. They really ran with that average. And I was like, so average obviously is average. Most nurses who are so like average would be like you have nurses who are brand new and then who have been here a long time. Obviously, if you've been here a long time, you're going to make a lot more. Most of those people aren't making like that much. The median people have usually left the bedside because the bedside's really brutal. So most people working the bedside are making a lot less than 80,000. Yes. So yes, we need to counter narratives and healthcare people are usually pretty quiet and it's kind of like a catch-22 for a lot of people because if you say a lot of things out loud, your employer might find out. So like I'm able to talk about it because I don't work for a healthcare system. If you do, a lot of people are worried, will this come back to haunt me negatively, right? So we're in this like weird bind, but if you can talk about it, please do. Nurse Adrienne said, yes, Twitter and email your local media and be the experts. Otherwise the press will continue to call management and in the hospitals and go there. D Spirit said, we're not quiet here. Excellent. I love it. Get loud and mad. That won't work for a slogan either. We need to work on it. Pay them, not me, just so you know who's in charge. All of our, where is this money going? It's the worst. So yes, that. Miss Nelly said there needs to be a way to hire PR to get your word out. If you're talking about me personally, I have no idea. I'm hoping that, like Second Opinion said, make sure you like and share this video so it spreads the word. Really do. If you like the video, an odd number of times perform compressions on it. It helps save its life and it sends it out to YouTube. If you like it, then literally YouTube will tell other people to watch it. So that's one thing you can do is you hit the like button. That's helpful. And it sends it to more people. And yes, I appreciate you for that. We need loud voices. We just need to talk about it more. We need more people to be the worst party guest ever, like me. And people are like, hi, how are you? So blah blah blah. Like anytime a hospital is mentioned or healthcare, I'm like, did you know? Like, I just can like wrangle it anywhere. Literally, someone was like, oh yeah, my mom was in the hospital. Like, she had to get a colonoscopy the other day. I'm like, did you know that like our situation? Did you go with her? And they're like, no. I'm like, never let your family members into a hospital by themselves. Do you want to know why? It's because your nurses do not have enough time. There's too many patients. There's not enough nurses. The hospitals will not let there be more nurses. And you do not want to know what goes on in there. And everyone just kind of like slowly backs away. And they're like, wow, yikes. Yikes, yikes. Oh, good. Miss Nellie said, not me having PR. I was like, yes, please have someone who's a little bit more polished on the topic. But the nurses who are striking, that would be a great idea. That takes a lot of money. A lot of money, but that would be an excellent things. Yes. How is it the hospital's responsibility to make up for the 10% inflation every year? Well, they're raising their prices 10% every year. You know, they're matching inflation with their prices. So, and it's also, this comes back to, it's a system problem, because you're right. It's not like the hospital is usually evil, but also not just the hospital. Like, I understand that we're also bound by the system that we're in. And the system, as we talked about earlier, is horrifically corrupt and designed to make money off of sick people. And until we change that system and make it accessible and something that people can actually use and function in, nothing is going to change, because a for-profit healthcare system will always benefit when people are sick, because they're making money off of sick people. AP nurse said, I was in the hospital for 10 days and had to stop multiple errors with my parents there, but they aren't medical, so they don't know. Yes. Always bring people with you. Always, always, always. People are so run thin and run dry right now. And I'm really sorry that was your experience. And then remember, because we're not retaining people, our units are run by people who are brand new and to absolutely no fault of their own. They haven't had the people to train them who are like the stoic, I've seen everything, everything is fine, you know what I mean, type of people. And Adrian says, remember, the hospitals figure out how to pay for supplies, drugs, billions to IT and electronic health registers, electronic health registers, oh my gosh, electronic health records, outrageously expensive equipment, especially in surgery. Yes, they are able to pay those. They're able to pay for a lot of different things that they would like to pay for. And yes. Oh, Marie B said, I've been sharing your videos and all of your MNA info about strikes on Facebook, probably annoying my friend, any friends and family I have left. I'm so sorry. I'll be your friend. Thank you. I appreciate you. Oh, I appreciate you. Collective action, together we bargain, divided we beg y'all. Yes, please. We need a lot of standing up together. A lot of standing up together. Okay. So that has been, oh, Richard King, I am sorry. And he didn't have a like, let me see what happened. I had to run my dad's CBL every 20 minutes, emptying the Foley and refilling the saline bag for hours. CBL is continuous bladder irrigation, where they're constantly putting fluid into your bladder, so it like flushes it out, and then the fluid comes out. You had to do that. And when I left to get his food, his Foley leaked all over the place. Oh, like how degrading is that for them? And he didn't have a bath for over 5 days. I had to do his ADLs, his activities of daily living, bathing, eating, all of that, and change his living when he was in an inpatient, because they're short on staff, friends. This is the reality when you're in the hospital, and the hospitals don't want to change that because they're like, well, we're getting by. You know what I mean? We're meeting the minimum standards. It does not benefit the hospital. I mean, it would technically in the long run, because less people would have complications. They wouldn't have to fight all these lawsuits. They wouldn't have to pay people off. The amount of money that they have to pay people off, that would pay for a lot of nurses, like a lot of nurses, which you would think, like, long game here, friend. Maybe if we just staffed things appropriately, that we would be able to like not have to pay so many people off, because they never go most of the time to a legal situation, because the hospital is just like, how much money will you take for us to just sweep this under the rug and we never talk about it again? And then they meet. And so there we go. And Mr. Midwife, Chad, I meant when they're not meeting the standard, I just meant like they're getting by, you know, enough people are staying alive that it's not raising too many red flags. Also, it helps that they pay the families off and they brush it under the rug. So, and Richard King, I am very, very sorry that that is what happened to your family member. Um, I'm very, very sorry. So yes, yes. Um, so let us take a moment and shall we just take a moment of levity? Oh, one more thing before we have our moment of levity. In case anyone is like, so the strike, how it's going, fine. They basically said, like, hey, we still like to meet. And the hospital's like, no, we'll talk to you when it's done. That's been the message pretty much across the board. Nurses are like, hey, this is clearly not good. You know, clearly this is not good when your hospital is being run by people who don't normally work there. Very capable people, but obviously it's just, it would be like someone coming in and being like a mama or a dad in a household for a day. Like if you replaced me or my husband with other like moms or dads, like they know how to keep the people alive. They would be able to keep my children alive, but they can't keep the house running, like we do because we live here. So that's the situation. So it's obviously not going well. The nurses are like, hey, we can meet. And like, if you want to discuss now, and the hospitals are like, no, like we're already here. We're doing our thing. So that's where we are now. But overall, it seems to be going okay. I've seen people dancing on TikTok. I will leave the links once again to go support them. You can like send them food, you can send donations, you can sign up to Picket. There's one day left, so maybe you can't sign up to Picket. That might be a lie, but that's when you like walk up and down the street and kind of let the public know what is happening. That's why the hospitals really don't like these. In addition to the patient safety issue, is it looks really bad when all your nurses are outside being like, "You suck." Which is why they're trying to turn everyone against the nurses. They're like, no, they're crazy. Let's gaslight you a little bit more. If you are wondering, why are they taking such drastic measures, and is there anything else that they can do? There is, they have tried to introduce a bill in the Senate that would be able to help this. It's just not going anywhere. So they introduced SF 3027 in the Senate. And this is the Keeping the Nurses at the Bedside Act. It has not, it was introduced 2/10/2022, and they did their first reading of it. And basically, this just goes through and it adds a bunch of things of like how to retain nurses. It goes through safe staffing ratios. It talks about how you could improve, like reduce violence in hospitals against staff. If you haven't seen our violence against nurses videos, I will leave that one linked down below too, of how often people are assaulted at work as nurses in all of healthcare, really. It would regulate like how long can nurses work? How often can you get mandated, like made to stay over even though your shift is done? This bill was like written and instructed and would be overseen by like nurses and nurse management. And it's just not being picked up super well. So I saw some things that said it was totally squashed. When I looked at the actual data, like on here, you can kind of see on the website, like um, what's happening here. And it just says it was introduced. And then they added some other people to it. So these things take like forever anyway. But if you live in the area in Minnesota, and you want to support this, these would be, and your person is on the Health and Services Committee. So if any of these humans are your senators, these would be great people to email and let them know why you support this bill and like explain this exact situation. Be like, hey, with all of this going on, like let them know you support it, let them know why. And again, offer to be that point person if they need someone to talk to. You can send them your resume, all the things. Okay. So Montana Gal said contacted my representative about that bill. Perfect. Yes. Will they share the outcome of the strike? Mama Nurse said. I'm assuming they will one day. Someone hopefully will tell us. I don't really know. I think we'll find out if they come to a negotiation agreement. It will be interesting to see what that is. The thing I'm going to be most interested about is I know Michigan has a nurse, they're considering striking, and Wisconsin is also striking. And yes, Nurse Adrian said, contact your elected of elected officials to support national nurses to patient ratio laws and anti-violence laws. And like Nurse Bridget said, push back against the hospital lobbyists because there are a lot of hospital lobbyists, like I said, and insurance companies who do not want the system to change because it's making them buku bucks. Okay, I think that's everything I wanted to say. Now, are you prepared for? Wait, where'd it go? Where'd it go? Okay, here it is. Oh, I have to make this go away first. Okay, gaslighting bingo, the best way to end anything ever, obviously. So, like I said, an email fell out of the sky, fell from someone's inbox, and landed in mine. Someone else did say, oh, Scott, you missed it the other day when we did it. Gaslighting bingo. So an email fell out of the sky from one of the hospitals that they sent out to their staff because the bedside staff was on strike, but not all the nurses. So this fell out of the pocket of someone else who works at one of these hospitals. And let us look at the email. If you, like I said, have an email that happens to fall out of your pocket, it doesn't have to be only related to this in general too. I'm hoping gaslighting bingo, if we like it, can continue into all other types of things because hospitals are always digging themselves in deep holes of lies and gaslighting. And I'd love to investigate it. You know, it's just very fun. I feel like a investigative journalist. So if anything ever happens to fall out, just email it to me. And it will very anonymously maybe be released. Okay, so today we have, and gaslighting bingo cards will be on their way through the newsletter. Check out the description if you aren't already subscribed. So I will be sending them out via the newsletter. You can sign up for it. I promise I won't spam you. I'll never go away your information. I just send out random like thoughts in written form, pretty random. And then any like, usually the other things that I talk about are like, weird books I'm reading, you know, just like little snippets inside my brain in a written form. And updates on things like this. I only send it out like once a month. I'm very bad at it, but it's there. Everyone told me you need to get an email list in case YouTube goes away. I was like, that's probably true. I probably should. So it will be going out to the email list if you would like it. If you're watching this in the future, check it out in the description. It might already be available for download if you are on the email list. It'll just get emailed to you. I also have free free templates for like nurses and nurse practitioners for my soap notes, for my my nursing brain. There's a whole bunch of other free stuff if you sign up for my newsletter. Then I have a way to give it to you because otherwise I don't know how. Okay. There we have. And then we have our bingo card. You'll see why you might want to be able to download the bingo card one day. Oh my gosh, it won't let me do 2 at one time. This is a learning experience, my friends. All right, next time. Look, I even put the other one on the other side so that I could have both. And then I forgot that you can't have both on the same screen. Okay, next time we'll have both. We'll read it and we'll go back. Here's our gaslighting bingo card. Gaslighting bingo, we just try to get bingo on the gaslighting points that we read in our emails or letters from our hospital administration. We really should have played it with that first one. It would have 1,000% been a bingo. So we will just give it the winner now. That thing we started with, that definitely would have gotten lying immediately, denying wrongdoing because they denied that, using what you love as a weapon. So this is like, nurses, don't you love your patients? You should definitely just do whatever we need you to do, without getting paid because you love what you do. Inciting chaos is just creating trouble, like creating general drama so that you can't focus on anything. And like someone had said earlier, if your world's on fire, you can't focus on the big picture. You're just trying to survive till tomorrow. You don't have the energy to fight back. Shifting blame. Everyone else is lying to you. So like, it's the nurses are lying to you. The nurses are lying to you saying that they just want patient safety. They don't really want that. They just want money. All sorts of eliminating self-confidence. Like, that's when you have people and they're like, no one else wants you. Who's going to take care of you? Who's going to hire you? Nurses, that type of thing. If you leave here, you have it so good here. So we had a lot of these. Rewriting history despite proof. We saw that many times in there. Using kind and loving words. We really love you, nurses. We know you're the best. You are such kind and caring people. We know you would not do this to us. And denying wrongdoing. So I think on this line, we have bingo. from my memory from the first thing. So congratulations, whoever you are at Twin Cities Hospital. You win gaslighting bingo. You should be ashamed. All right. Let's look at M Health. This is another one where I must have like had better vision this morning because now I'm like, wait, what? You thought I could read this past self? That was bold. Dear colleagues, this is from an email. Someone did say that I think Ascension blocked all of their nurses from their emails. So you can't send, things can't fall out. But if you know other people that work there and it falls out of their pocket into your pocket and then into mine, accidents happen and sometimes they're severe. So we understand. Email, always open. Dear colleagues, this morning we welcomed many new faces into our hospitals as we continue to focus on the care of our patients. Here are updates as of 4 p.m. Many new faces are all the travel nurses that are coming in to fill the spots. We have had a smooth and efficient transfer throughout all impacted hospitals. Somehow I feel like that might be overselling it a little. I have no doubt that these people, like I said, are capable, but I can't imagine it was flawless. But good. You be optimistic. That's nice, Laura. Responding to the site needs and communications, we had the Minnesota Department of Health with Visit Southdale today. So it was a planned thing. Like I said, they were coming in just to make sure. They said, oh, we're going to go in and see if things seem safe. With no concerns noted, what is your bar? That's what I would like to know for the Michigan or the Minnesota Department of Health is what was your bar for too unsafe? Because they also had to keep in the back of their mind, what is more unsafe, providing unsafe care or shutting down a hospital, which as we have seen in the video we just did on the Atlanta situation where they're shutting down one of their hospitals that serves a very vulnerable population and they're just like closing because they're the villain. It's not good when you just shut down hospitals. So the Department of Health is very much weighing that, said, what is more safe. And capacity today with no concerns or nothing enough to shut you down. Curious. Capacity has been very high with pockets of staffing issues, but not dissimilar to other days in our system. So we have minimizing there. So we're busy. We don't have enough staff, but it's not more of a poop show than it normally is. So just minimizing anyone's feelings. That's nice. That's on our bingo card. Where do we have that? Yeah, minimizing thoughts and feelings. Good. Distraction. Everything's fine. Everything is fine. And spreading rumors and gossip is like talking crap about you behind your back, which is if they're talking crap about the nurses. Let's see if they do that. The first article definitely did. Labor and delivery and pediatrics and mental health services to continue to be busy. Well, that's not shocking because people in labor and delivery are not going to be like, I'm not going to go to the hospital. This baby's falling out, but I'm not going to go because they're having a strike. They're going to still go. Peds, there's only so many places you can go. Parents are going to like take their kids. And mental health. You cannot just be like, wow, I no longer want to harm myself or others because there's a strike. So that's not shocking. Other people I feel like might be like, I might be dying of a heart attack, but I might wait. I think I might wait or go to this other hospital. So I'm not shocked that these services have not declined. Also, we're in a mental health crisis where it's impossible to get care. So I don't think people are going to not show up. The contingent nurses have been very complimentary of the onboarding and process and welcome they have received, and we're thankful for their help in caring for our patients. So actually, all you dum-dums who didn't come to work, you should know they've been very nice about us. They've said very nice things. So there. So that's a lot of like, I don't even know, denying wrongdoing. We didn't do anything wrong. Remember, you're the bullies here. This is going really great. They love us, actually. So they really, really, really love us. The problem is you, not them. Not us, it's you. Planning for events like this takes dedicated effort from all of us across the health system, whether you're directly impacted or not. And it's not lost on anyone that the work you've put in to help us continued care for the patients and has had a profound impact on our ability to provide care for those in need. So this is a whole lot of complimenting you to make you feel like, oh, maybe this person does have my best interest in heart. You are using kind and loving words as weapons. Not good. So maybe we're going for bingo this way. The long game is wearing you down over time. So basically like tiny little jabs over and over again until you kind of like eroded at your soul, kind of like what they've done to nurses just in general, right? Because we're now like, we accept all sorts of stuff that maybe at the beginning we wouldn't have accepted because we're like, well, I mean, it's not as bad as like it's just happened over time. By the way, if any of these things are happening to you in any relationships you have, that's gaslighting, friends. So this has dual purpose to get you out of situations in your life, or at least aware that situations or relationships might be abusive, while also highlighting that many of our healthcare bosses are very abusive. And so, yay, thank you. You've done great. On behalf of the leadership, we thank you for all that you've done over the last several days, weeks, or months to ensure our community can continue to count on us. It's about the patients. We're going to use the people you love against you. Rely on that fact that they know that you have compassion against you. I want to ensure that you have the most accurate information available. And this is where I got that link to that Twin Cities thing. Here, go read this thing that poops on all of our nurses. So let's just real quick, let's just talk about how all those other sneaky little dirty nurses, let's spread and gossip about them. Okay. Let's just get people on our side. They're wrong. We're right. You might see this letter that really poops on what they're doing. We know you wouldn't do that though. We know you wouldn't do it because you're the best. You're the best and you're helping us and patients more importantly. And remember, the new people like us. Remember that. For updates metro wide, blah, blah, blah. And wide updates, blah, blah, blah. We will be so happy to welcome our union represented nurses back to work at 7 a.m. on Thursday, September 15th, when the 3-day strike concludes. At that time, scheduled shifts will resume and union represented nurses are expected to return to work for their scheduled shifts. Okay. In the coming days, I plan to provide operational updates as needed. If you have any questions or concerns, you can reach out to your manager or connect directly with the command center by emailing this. Our focus is and will always remain on ensuring that we can continue to provide high quality care to our patients. I'm not sure we got a bingo on that one, but it was entertaining and pretty gaslighty. So yeah. Stephanie Pajari said St. Luke's and Duluth is claiming their average nurse is making over $100,000 a year. Is that including, that's a good question. Is that including bonuses? Is that including overtime? Is that including mandatory overtime? Is that including all of their nurse managers and all of their CNOs and all of their nurse practitioners and all of their caseworkers, all the people who are probably making nursing educators that are making a wee bit lots more money? Are you including all of that? Because you can't include overtime in base pay that you forced people to do. That's not how this works. So that is our article. We didn't get bingo. We got bingo on the first one. So like I said, we got to keep playing so that we can keep winning. It's very addicting. Let me know in the comments. Actually, let's make a poll. Let's make a poll. Oh, I never closed out our other poll. That's not good. Something probably happens there. But if you were curious, 61% of you were familiar with the thing from the strikes in Minnesota, and 38% of you were not. That's in all caps. I'm not yelling anymore. I'm calming down. The caffeine is exiting my system, as is the rage. This has been very therapeutic. Thanks for listening to my rage. Do we like gaslighting bingo? Because I've just been forcing it on you. So we'll see. It's okay to be honest. You won't hurt my feelings. I have lots of ideas that are bad. Yeah. And like, exactly. Or if you're getting to 100,000, are you also including in that 401k? So like things that are going into your retirement. So your benefits that are like not something you are taking home right now, because that's not right to include in your pay. Your PTO, your paid time off, all of that type of thing. Like, is all of that added? Yeah, because that would make a mess. So obviously they're coming out and making a statement saying like, oh, look at us. Let me see if I can find that really quick. St. Luke's, Duluth, Minnesota. What should we Google? Nursing strike. Let's see if they have a statement on it. They have the Duluth Tribute. Oh. Let's see. They brought in Oh, this is interesting. Let's look at this one. Because this is filled with straight up lies too. So that's exciting. Um, hmm, feelings. So Duluth, who's claiming their nurses make over $100,000 a year, who are probably including a whole bunch of people and numbers that aren't helpful or realistic. And also, a majority of nurses at St. Luke's have voted no confidence in the leadership. So they don't think that they have good leaders. Duluth, Minnesota. So this is in their Duluth News Tribune. So someone tell me if that's legit. They go on and they are obviously they're going to these hospitals and that's where they're getting their information, right? Is they're going there and they're saying, hey, this is, here's the information. They're probably also trying to contact the Minnesota Nurses Association. And if you live in the area, email them your resume so they can maybe talk to you. Okay. They'll be fully open. St. Luke's healthcare system is working with staffing agencies to work with everyone. They're going to cancel a small number. A small number. What is a small number? I mean, of course, you're going to cancel your elective surgeries. You don't have the staff that's trained there. And Stephanie Pajari, thank you, says that's our major newspaper. Okay, perfect. I wanted to make sure it wasn't some like random one out there. And everyone's like, no, that's like a satire website. Like, oh, okay. MNA members may be picketing outside the hospital campuses. People are advised to drive carefully. So that just kind of seems like, they may be a public nuisance. Drive carefully. I might be reading into that. That might be my bias coming through. St. Luke's, Essentia, and 5 Twin Cities health centers have filed unfair labor practice charges with the National Labor Board relations, claiming the MNA did not notify the necessary federal and state mediation services. So this is a lie that we've included in this. So this is nice that they're putting this in here, making it sound like, and the union is doing things illegally. We talked about this last time. They keep claiming that the nursing unions did not give them enough time. They gave them 10 days, and they're saying they should have given them 30 days in order to announce the strike. That's only at public institutions. At private institutions, you don't need to do that. But they keep putting this in the news. This is something that the Right to Work Foundation, they're like the people who are super anti-union, they keep spreading this, saying, hey, they didn't even go about this the right way. And in reality, that's a lie because that's not something you have to do. These are private hospitals, and at private places, institutions, you don't need to file that other thing. And again, they didn't want a mediator because they were like, let's not bring in a middleman here. Let's just figure this out ourselves. Why complicate it more? But the way they make it sound is that the union won't even meet, and they filed and they messed up. Because they're saying Essentia filed additional charges on Wednesday, claiming the MNA did not include Essential Health Duluth on its list of facilities impacted by the strike. That may be very true. I have no idea. Because MNA failed to complete a required filing. We believe a strike at this time would be illegal. It's not. Obviously, they were able to have it. We expect MNA will not ask nor expect their union members to participate in an illegal strike, and they will withdraw the planned strike. However, if the strike occurs, we are prepared. So this is, again, just painting nursing in a really bad light, being like, obviously, the nursing situation, like they're run by a corrupt, this is painting the union in a really, really negative light for someone who if they're just encountering for the first time, they're going to see this and be like, oh, like maybe they are evil. And FMCS was notified. They always are with private facilities. Exactly. They just didn't have to give them. They were saying, oh, you needed to give us 30 days, not 10 days. At least that's my understanding. Adrian, you can let me know if that's right or wrong. So there we are. That's where we are. Teachers don't even get treated like this. Well, teachers we're kind of in it with the teachers. It's a whole mess. Coding Zombie. Oh, this is some good inside deets. Stephanie Pajari said, Coding Zombie in Duluth, base pay for nurses is around $35 an hour for work with a 0.6 schedule. So that's 0.6 is like if you're working, you're making like $35 an hour, which what would that come to? Base pay for nurses. This is all the inside deets. A 0.6 schedule means you're working like a little bit more than part-time, but you may not that wouldn't necessarily affect your like base pay. So if we have 35 an hour times, let's just say they're working full time, 36 hours a week times what, 52, that's 65,000. So 80,000 when they're coming in and saying, well, first they came in and said most of our nurses make over 100. So you're definitely including the full benefits package, and probably a lot of the work nurses who work in upper management, maybe even nurse practitioners, CNSs, educators, because 65,000 is where you're sitting as a base pay nurse, which is certainly not the average that all these people are claiming. And a mess. Lies. Adrian said, union will notify FMCS. I think that's something about someone you have to notify in the government about the fact that you're doing a strike at the beginning of negotiations to be ready and assist and mediate. Mediation is not binding and impasses can be reached. So basically the nurses vote to strike. They say, yes, we agree that we can proceed to striking, that we're at the level where we would like to use that weapon. Because I mean, it's the weapon in your back pocket. And then if they don't come to, then they all go back to the table and they say, can we agree on this? The situation is dire. And if they can't, then they say, okay, we might call a strike. And then when they do strike, they need to give 10 days notice, which is what they did of the official strike. So they did everything correctly. These hospitals they're making things up to make nurses seem bad. So that, my friends, is where we are. Alex Haney sums this whole thing up. Well, healthcare that is based on making profits will never prioritize employees' well-being and the patients. Exactly. Exactly. So that's where we are. Thanks, friends, for being here and listening to my rambles. I hope that someone out there who is watching this, if you are a non-healthcare person and you're watching this, please let me know. It would give me mild hope to know that someone out there is watching this, that it is not. I want nurses, and obviously I love our nurses. I very much appreciate you being here, but it would also give my soul a tiny spark of happiness to know that someone learned about this and maybe got information that they were not fed from somewhere else. And we're like, oh, like maybe I'm going to question things and look at this. If you are not a healthcare person, please let me know if you're watching this. That would bring my soul joy. 80% of us, 79% of us like gaslighting bingo, and 20% of you don't. So we will keep attempting. As long as you keep sending me things, I will keep trying it. And let me know. Sorry for the 20% of you who hate it. We'll try to keep it quick. I think it's kind of fun. I get to be very snarky. Hopefully we get some real tea. We've gotten some really snarky letters before that we did. And yes, I appreciate you. Please do send support to the union workers right now. And yeah, because they're kind of being publicly pooped on, and that's really, really hard. And they feel bad. I'm sure they feel bad because I'm sure they feel like a lot of them feel like they are abandoning their patients, even though they're doing this for the good of themselves. Like they're standing up for themselves and their patients. I'm sure they don't feel great about it. So we can be kind to them, show their support, spread the word, try to battle information that's incorrect, that we kind of still like talked about. And yeah, I appreciate it. And thanks so much for being active in the chat. Like Montana Gal said, this helps a whole bunch to just kind of like have a community to chat with. These have been getting like, I love seeing the conversations you guys have. I watch after I go back and watch the whole thing and just read what everybody said because I can't catch it all. And I appreciate it. So thanks for being here. Always, if you are looking for ways to support the channel, you can become a member. Which is like linked down below if you're on your phone, I think. And that just has random extra videos and then a Discord server that is like halfway done where we can like actually chat. And it just helps me keep doing what I'm doing and keep second opinion around. You can like the video, you can subscribe, you can share it with people like the brave soul who shared it on Facebook and now might not have any more friends, but you have me. I will be here. And yeah, all those things. Or just leave me nice comments or go attack the people in the comments who are mean. Because I don't delete comments. Some of them YouTube does hide because it doesn't like bullying and when it kind of like has its senses and it knows. But if you're ever feeling feisty, my comment section is always a good place for a fight. And any engagement is good. So I just keep the bullies going. I just keep commenting back and forth with them. People are like, why do you engage? I'm like, because any engagement is technically good engagement. And I'm ready. So that's where we are. I hope you very much remember, my dear friends, that we are stronger together. Absolutely, Rogue NP. We are stronger together. Go Team Nurse, go Team Healthcare. We're going to change the world. Let's get mad. And you are not alone. We're all feeling like this. You, my friends, are more than enough. Do not take less. You are allowed to get paid. You are allowed to be treated with respect, and you are allowed to go to work without worrying about getting shot. And you, my friends, can do hard things. Until next time, goodbye. Adios. Au revoir. Auf Wiedersehen. I was like, wait, how many languages do I know goodbye in? I should know a lot more German. I spend a lot of time on Duolingo. That's kind of embarrassing. Let's see. Did you know in German, hospital is Krankenhaus? Like, and an ambulance is Krankenwagen? I'm like, well, this is a great language. We need more of that. Good night, friends.